the executive director of the organization, the Zimbabwe Liberated Girl Child in Action. And this is a group of young girls, the children of war veterans, who are here to help their community, who felt the need to be responsible citizens. And it is also a group of girls propagating the principles that underline the mandate of the liberation war, which our parents fought for. So in everything that we are doing, we are trying our best with that little we have to help in our community. And one of the ways that we are appreciating the liberation, the sacrifice which our parents went through, is by doing that little we can, by donating, by visiting those who are in jail, by being part of your patients in the hospitals. We would love to partner with you, help where we can. We've seen that there is a dire need in hospitals of some of the mothers who come from the rural areas. They come and deliver, probably they have nothing with them to assist. So we are here to cover that gap as the children. It's that era where the war was already won, and as the children, we can't go back to war again. So the best we can do is to fight with that little we have for the humanity, and to help our brothers and sisters out there who are still trying to find their way. And in our organization, we've started projects. We're realizing that in our country, some of the things which are being a problem is that our youths have nothing to do. So as an organization, we're coming up with projects for the youths worldwide: farming, mining, fishing, sewing, whatever project we can do with our girl child. We can see that the girl child in most of the areas hasn't been considered, but we are coming with that girl child and empowering, giving them power, giving them something to do, allowing them to stand on their own so that they can be able to come up responsible citizens, that they can be able to stand even in their areas. And we also come to encourage other proud daughters of the liberation to come and stand with us with pride to champion the gains of the liberation. And as an association, would love to really stand and help them throughout Zimbabwe, wherever they are. And with the hospital, we know there are also kids who are left in hospitals with no parents. Some of them, their parents would have passed on, and some of them, they are sick, and some of them are actually just underprivileged with no one to help. So we are coming as an organization to complement the government efforts to help build the country with that little we have as the girl child. Thank you.
We are delivering a huge number of patients. So on average, every month we deliver about 600 patients. About 45% of those patients, they are cesarean sections, and about 55% they are normal deliveries. And this number is quite huge. It's because there used to be a results-based financing program that was coming, and most patients would prefer to come and deliver at our center. So we have a huge influx of patients coming from different clinics in our city. Unfortunately, the RBF has left, and still our referral system has not changed. We still have quite a number of deliveries at our hospital, which is overwhelming our hospital. But as a hospital, we are trying to cope and meet the challenge in terms of training specialists, and also trying to recruit more nurses in that department so that we deal with the challenge. We have a challenge of sundries, but also as a hospital we've come up with ways to try and meet these challenges, where we try and source these sundries using hospital funds. So the donation that has come to us from the Zimbabwe Liberated Girl Child in Action will go a long way. We have seen blankets, we have seen for the children, we've seen fruits, we've seen pampers. We see a lot of patients who come from a poor background who cannot afford to buy these sanitary wares and pampers for their children. It's going to go a long way in alleviating their challenges and to meet some of their challenges. It also makes it easy for us as health professionals to render our services when we get such a donation. So this is a gesture that we welcome, and we would like such partnerships where we try and meet our different challenges. We work with different organizations to try and meet our challenges at our hospital.